Okay, hi. As promised, I'm going to show you some techniques that you can use for yourself and techniques that you can use for your partner while we're all kind of stuck, cooped in the house during the corona thing here. And these are going to be very effective. These are reflex points. It's less massage and more to do with balancing the entire body through these reflex points. So I'm going to show you how to do it. I'm going to do each one for just a little bit, just so you can kind of understand what's going on. So what you're going to do for the first 2 points that I like to hit are on the top of the pelvis. So you're going to feel for the person's top of the pelvis, and you can do this at the same time if you want to, or you can do one, work on it for a minute or so, and then go to the other one. It doesn't matter. You do what you'd like. As far as the pressure is concerned, see my fingers pressing into my daughter? This is my daughter Jess, by the way. My fingers are just enough to just create some contact. I'm not really pushing very hard in there. It's just enough to create some contact. So we're coming up here, and again, we're just going to stimulate these 2 points on either side of her spine, right above, so not on the bone, but right above the bone, and you can just do these small circles. And again, I normally would do this one at a time, but you can do both at the same time if you want to as well. And then if you come up just a little bit higher, so if this is where the first point is, the second point is just up just a smidge bit higher. And then you can do the same thing. You can use 2 hands at once, or you can just rotate one hand. So, well, I mean, 1 hand, 2 hands, 1 point at a time. So this portion of this is going to be the upper back, and then I'm going to show you the lower body that you can do as well. And you can do the entire thing in one sitting in about 15 or 20 minutes. So this video should be about 8 minutes or so long. And this is just very good for getting the tension out of the top part of the body. So again, first 2 points, second 2 points. Now we're going to come up through here. Now here's my daughter's scapula. If you come about halfway, you're going to be in the right spot. You can see her scapula stick up through here. Here's the bottom of it, here's the top of it. I can move it back and forth like this. This is where you want to come and then just fall off the edge of it. So you're on the rib cage, but this point, if you're right in through here, and I can feel the point of my daughter. You feel that different, Jess?
Yeah.
Yeah. For my daughter, the point is a little bit lower. But generally speaking, most people, it's going to be halfway. But I can feel that point for my daughter is just, yeah, right? You feel that, right? It's slightly lower for her. It's right here. This is what I'm working on for her. And again, this is not a lot of pressure that I'm using, but you can see how she's reacting to this, right? So this point is overactive, and because it's overactive, it's creating discomfort. So what these reflex points help to do is they just kind of help to bring everything flowing, and that's what you're looking to do. Again, don't think of necessarily pushing down hard. That's not what you're looking to do. So those of you who have had massage from me in the past, you can understand what the pressure feels like. So when you're doing this to your partner, have your partner give you some feedback. See, that's loosening up, right, Jess?
Yeah, it feels better.
Yeah. So we're going to come over here. So same thing. Let's see what this point is on this side for her. Top of her scapula, bottom of her scapula. We come to about the middle, and they're both. She's got 2 active points here, so I can feel these both. So for her, this one here is a little bit more sensitive, right, Jess?
Yeah, definitely.
So we're going to do the same thing. We're just going to make these small circles.
Yeah, right there.
Yep, I can feel it. So this one is closer to where it should be as far as where it is in the body. And none of these points are pinpoint accurate. It's not like acupuncture where you got a needle hair thin hair, hair thin needle that you're sticking in. I like these techniques because it's kind of the general area, right? And I like that. So we're just going to keep doing this. And I'll treat you later, Jess. This is just more of a show than it is anything else, but that still needs some work. Next, what you want to do is you want to find the edge of her scapula. The easiest way to do that is to feel the bone where it comes down this way, and to feel the bone where it comes this way. And you're going to come, and they meet at a point. This is going to be sore on almost every single person, especially people who work in an office. And all you're going to do is find that point, and same thing. You're just going to press into it.
I'm so tense.
Yeah. My daughter was so eager to volunteer her body to show you all.
Oh, God.
So same thing. So this point you can spend some time on, okay, with people, is work through there. And again, you're going to do this on both sides. The next thing you're going to do, believe it or not, is you're going to come to the edge of the scapula, which is out through here. So if we follow from where we just were and we come out to the edge of the scapula, right there is where her scapula ends. And what we're going to do is we're actually going to work down the tricep muscle a little bit, because there's some reflex points in through here. There's 4 little points in through here that we're going to hit. And all we have to do, again, is the same sort of a technique. We're just working down the back of her arm, not so much on the deltoid, but you have to kind of go through it a little bit, but we're more on the tricep muscle. And you're going to come down to about this point. That's it. So you're going to work through here, down to about this point. And then you're going to stop. And again, you would do this on the other side of the body as well. Let's get into the neck. So her neck, there's almost nothing you can do here that's not going to not feel good. One great point though, and this is so good, this is, some people had reached out to me, and I won't call out anybody's name, but some people had reached out for me with some tension into the back of the skull. So if you feel the back of the skull, so her skull here, and where these muscles come down is they come down through here. So they come up and focus themselves in through here. This point in through here is going to be sore on almost everybody. So don't press on the middle of the spine. You don't want to press down there. So you want to just feel where the spine is and then just fall off of it just a little bit. The person should help you be able to guide you and say, oh yeah, that's the spot. And all you're going to do is you're going to just go back and forth. The same thing. Circles, back and forth, up and down, until we get these points. And what you can do for this person is you can go in through here, somewhere mid part of the neck, and do the same thing. Just back and forth, up and down. Okay, so just to reiterate what we did, we started down here, we hit these 2 points, we came up a little higher, we hit these 2 points. We came up to about midway through her scapula, and we hit these points. We hit this point that's in the top corner, we hit that. We worked our way down into the tricep muscle, and then we worked our way up into the point up through here, and worked down into the neck. And again, small circles, back and forth, wiggle the person's body around, it all works, okay? So, that is the upper body, that's part 1, and I'm gonna show you on part 2, the lower body, coming up, okay?